My name is Dr. Heather Roberts, and I'm in private practice in Los Angeles. I've been practicing for 19 years, and my practice is devoted to complete individualized care. So patients come in knowing that we take care of their medical issues as well as their surgical treatments and their cosmetic treatments as well. So Fractora is one of my favorite treatments because, working in Southern California, patients are exposed to the sun all day long. And, more and more patients are leading busy, active lifestyles, so they want treatments that are going to give them significant improvements without a lot of downtime. And so this is a way to naturally boost their collagen production as opposed to having to use an exogenous filler or something else. The results that we're getting with Fractora are really impressive and outstanding. So with Fractora, patients see improvements in the overall quality of the skin is smoother, the lines are diminished, they get tightening and lifting, and a lot of patients just get this brighter, rejuvenated look, from both improvement in pigment and from increased collagen production. One of my favorite stories with InMode is a patient of mine who'd been suffering with severe acne scarring for years, to the point when whenever he would come in the office, he could barely even look you in the eye. You could tell he was so self-conscious about his appearance. And we had tried other technologies prior to having the Fractora in my office. And then when the Fractora was available, I had asked him if he was willing to try one last thing to see if we could make an improvement in his skin. And the results were so dramatic that after even his third treatment, he was coming in smiling, he had a much lighter demeanor, and he ended up doing a total of 6 treatments with very significant improvement in his skin. About 15 years ago, I tried a few of the tightening devices on the market, and I wasn't super impressed with the results I was seeing. Waited a couple more years, the technology seemed to be advancing, and so I introduced a monopolar tightening device into my practice. And it was really disappointing, actually. About 30% of my patients would get some kind of, good result, 30% wouldn't get any result, and if I was lucky, 30% would get a better result. So, having patients spending the time and money on a treatment that wasn't working for them didn't make me happy, didn't make them happy. So I then switched over to a sublative technology. And with that one, we got a little bit, nicer tightening and lifting, and we were able to get more consistent results. But the downtime became an issue for patients. They didn't like having the little crusty scab grid on their face for, a week or so at a time. So when the InMode technology became available, that transformed my practice in terms of tightening devices again, because we could offer patients devices that had no downtime, like Forma, and if they were willing to have a little bit of downtime and get a little bit even more significant result, then we have Fractora. So what makes Fractora different than other fractional devices on the market, in my opinion, is you're getting both the combination of the radiofrequency ablation as well as the full heating of the dermis to really stimulate, deep collagen production and give that immediate tightening and lifting. So Fractora works on the skin through bipolar radiofrequency. It's delivered through a series of pins that are inserted into the skin. So you're getting both an ablative effect, and depending on which pin tip you use, you can get partial ablation or full thickness ablation to 3 millimeters. You're also getting this nice heating under the skin in the dermis with the radiofrequency energy to get immediate tightening of the collagen fibers and then induction of new collagen production through the fibroblast. So the benefits that I focus on for my patients with Fractora is really the wrinkle reduction, pore tightening, and lifting. Depending on which pin tip I'm using, then also patients can get some improvement in overall skin tone and decreased brown spots, and even some improvement in their acne. So Fractora has become a great treatment for the neck because, again, a lot of patients don't want to have a surgical procedure. And even a traditional surgical neck lift will not improve the quality of the skin. So with Fractora, you're getting smoother, brighter looking skin, you're getting tighter lifted skin. So you're getting the best of both worlds with improved skin quality and tightening and lifting without a lot of downtime. So initially I had started using the 24 non-coated pin. And then in the last 10 months, I've really shifted almost exclusively to the 24 coated pin because with that pin, I was surprised to find that even though I thought I was only get improvements under the skin, I had many patients with very fine, thin skin that were getting improvement in surface wrinkles as well as the tightening. And then with less downtime, it makes it accessible for a much wider range of my patients who are busy and working. So for me, the endpoint with Fractora is both, trying to get the right number of pulses, whether I do that with 1 or 2 passes, depending on if I'm doing, double pulse stacking or triple pulse stacking. I'm also looking at the patient's skin. If the patient's skin is not getting, too red, too swollen, if I'm not seeing too much ablation, because we don't want to turn this into a fully ablative procedure. We still want to keep it fractionated. But usually with about 1,000 pulses on the face, I haven't had any problems with that. I would say in terms of the number of treatments to start to see results, with anti-aging, majority of my patients will see improvements even at 3 weeks after their first treatment, and that continues up to 3 to 4 months from the treatment date. For acne, most patients, depending on how active their acne is, how much scarring they have, I would say it's probably going to be around the second treatment when they're going to really start to see significant improvement. But again, many patients see a very significant improvement even after their first treatment. I would say that for my experience, duration of effect has been a year or even a year and a half in many of our patients. Carol is 69 years old, and she leads a very busy, active lifestyle and is outdoors in the sun quite a bit with her gardening. She's interested in improving the lines around her mouth, as well as getting some improvement in the skin tone and the tightening in her cheeks, as well as correcting some of the fine lines around her eyes. And with the treatment, we can also improve her overall skin quality. So she should be able to get back to her lifestyle within just about 3 to 4 days. So today we're going to use a combination BLT, which is benzocaine 20%, lidocaine 6%, and tetracaine 4%. And the formulation that we're using is milled into finer particles, so it gives a little bit better absorption in the skin for stronger anesthetic effect. We're also going to be injecting some local 1% lidocaine with epinephrine around her eye area to give a little extra numbing in those areas so we can be a little bit more aggressive with her treatment in that region. Today we're going to use the 24 coated pin, mainly because a couple of reasons. She doesn't have a lot of downtime. She's going to be out in the sun again, probably within about a week or so. We want to get some really nice tightening and lifting. And actually, even with this pin, I've been surprised. I've been able to give patients significant improvement in their fine lines and wrinkles as well. So with the 24 coated pin, we're going to start off with a setting of around 20 fluents. And then we're going to see how she's tolerating it, and hopefully we can advance from there up to 25, possibly even 40. So to figure out the right settings for the patient, as I'm doing the treatment, I look to see how the skin's reacting, how much redness, how much swelling they're getting. I look to see how the patient's tolerating it. Are they comfortable, or are they wincing, and are they kind of at their limit? And then, of course, when I look at the quality of their skin. So patients that are, have thinner skin, maybe more sun-damaged skin, sometimes have to use a little bit of a gentler setting. Patients that are fairer skinned, often I can use a little bit of a stronger setting, although with the coated tip, it's not really as much of an issue with the setting and skin color. The technique that I like to use basically is I like to do 2 passes if I can. So I'll often go, one direction first and doing, lining my pulses up with 50% overlap, and then trying to keep nice straight lines so that we're not getting side to side overlap. Then once we've done a full region in one direction, we go to the other side of the face, let things settle down, and then come back and go perpendicular to that direction. Around the mouth area, I tend to go perpendicular with my pulses around the mouth, but sometimes I do then for the second pass turn it just so we're getting nice, complete surface coverage. Around the eye area, typically I will start at the outer area. Seems to be a little less sensitive for patients that way. Also, as they get used to it, they're less jumpy. And then I trace, medially under the eye. And for the upper lid, if they have enough space, I lift up on the lid and then apply the tip and apply good pressure to try and get a couple pulses right up here to get some nice tightening. Of course, we never put the tip right, over the globe itself or the moving part of the eyelid. So neck treatments are a little bit different than face treatments. So to prevent a lot of muscle contraction and make it more comfortable for the patient, instead of pushing the tip into the skin with the neck, we actually lift the skin off the muscle, and then we take the tip and we push it into the skin. And that makes it so much more comfortable for the patient, and you can get a very nice, even coverage of the neck doing that technique. So the pin tip that I use on the neck, again, depends on the patient's tolerance for downtime, their skin type, how thick their skin is, and how dark their skin is. For someone like Carol, again, because she does have minimal tolerance for downtime and she wants to get nice tightening as well as maybe some improvement in the surface lines, I would use the 24 coated pin. If she did have a little extra time, then I might consider instead doing the 24 non-coated pin or doubling up on the 24 coated pin with the 60 pin. But again, it would depend on her tolerance for more days of redness, swelling, and crusting. So prior to doing Fractura on any patient, we have them come in for a consultation so we can get a complete medical history and find out if they have any history of cold sores or fever blisters, which would require them then to take an antiviral pill to prevent a flare with the treatment on the face. We also want to get an idea of how much downtime tolerance they have, how much sun exposure they get. We don't want to treat the patient when they've got a lot of, sunburn on their face or even active sun. And preferably if they can stay out of the sun for a good 4 to 6 weeks after the treatment is ideal. I also like to find out if my patients are on blood thinners. A lot of patients don't realize that fish oil and some of the other supplements that they're taking can cause bruising. And again, because patients are very mindful of how much downtime they're going to have with the procedure, even if I use a setting where they typically would only have about 3 to 4 days of true downtime, if they do get a bruise, then that can extend their downtime up to 2 weeks, which will not make the patient happy. So we're going to work on the cheek area to lift the cheek and define the jawline, help to improve some of the fine lines in the medial cheek, as well as around her mouth. We can do some pulses here in the glabella and crow's feet here to get some nice softening, and then just an overall improvement in her skin quality. For her neck, we'll be able to address the laxity and some of the solar elastosis here, as well as try and tighten up these areas. Right, so we're going to treat, under and around the eye, and then we're going to see if we can get a couple of little pulses up here on the upper lid, but again, we're going to make sure to lift it so we're only pulsing in the fixed part of the lid and not getting any treatments on the globe itself. When the patient comes in, preferably they'd come in without any makeup on or sunscreen, but sometimes they're coming straight from work, so when they come in, we clean up their face, take off the makeup, and then apply the numbing cream. So I'm going to go ahead and remove Carol's lipstick, and then, we also like to remove any moisturizer on the skin so the patients don't get any problems with clogging of the pores, especially because we are using a pin device where we're going to be inserting the pin into the skin. So I'm going to start applying the anesthetic to her face with the tongue blade, and then we're going to massage it into the skin so it really penetrates well into the skin. Now, Carol has a cosmetic tattoo in her brow here that we definitely want to be careful not to do any Fractura both over the brow itself so that we don't get any removal of hair, and also so we don't get any sparking of that tattoo. So we're going to wait about a half hour to 45 minutes to allow the numbing to settle in before we'll come back and do the local infiltration around the eye, and then we'll get started with the treatment. So the next steps for Fractura will be removing the numbing cream, which Carol's had on for about 45 minutes now. And actually just prior to that, we're going to inject some local anesthetic around the eye area so she's nice and numb for that part of the treatment, and then we'll get started. So we're going to use a 1% lidocaine with epinephrine buffered with some bicarbonate, and then we're going to inject superficially under the eye, around the crow's feet, and then coming up into this upper lid area. So I'm just trying to create a little bit of a bleb in the area. It's probably about a half a cc that I'm putting into each section and trying to inject through the areas that are previously numb so she doesn't feel it too much. And I'm staying pretty superficially. There are a lot of blood vessels in this area, so we want to try and avoid any additional bruising if possible from the anesthetic itself. Okay, so we added an additional half a cc, so 3.5 cc's on the left eye and 3 on the right eye. So now we're going to go ahead and take off the numbing cream, and then we'll get started. I'm going to do a pass of alcohol over the skin as well to degrease the skin completely and clean it fully. We're going to be using a 24 coated pin tip, and it just snaps into the end of the handpiece. And then we're going to go ahead and get started with the lower settings, starting with a fluence of 20 and seeing how she tolerates it, and then going up to 25 and higher from there. We're going to start treating Carol in the crow's feet region. It's very important to stretch the skin prior to applying the tip to the skin. We're going to be applying some firm pressure. Once we have good contact and firm pressure with the skin, then I'm going to release the pulses, and the pulses are triggered through a foot pedal. I'm going to be doing triple pulse stacking today, so I'm going to be delivering 3 pulses in the same area before I move on to the next area with 50% overlap. Some physicians choose to use double pulse stacking for the full face or around the eye area, both for a little bit of better patient comfort, and if they're a little worried about over applying the treatment, double pulse stacking, especially when you're first starting, is probably a safer way to start. All right, so we're going to go ahead and start. So I've got nice stretching of the side of the eye and a little pressure. I'm going to release the pulses. So because she has the local infiltration under the eye, it makes it easier to come in nice and tight under the eye. Now I'm going to come up to the upper brow area above the lid. And again, stretching the skin, putting firm pressure, and releasing the pulses. On this side, because it's a little bit of a smaller area, I'm going to turn the handpiece perpendicular. I want to avoid this area of her cosmetic tattoo. Also want to avoid being on the moving portion of the eyelid. So we're going to go ahead and stretch and press and pulse. Again, I'm going to stretch and press and pulse. Now I'm going to do another row around this area. So we're going to go back to the crow's feet region, and again, stretching the skin, pressing and pulsing. The 50% overlap is very important so that you don't have the rail marks afterwards. So you don't want your rails to line up exactly. Now I'm going to come in just a little bit closer again because she has had local anesthetic. So I'm going to come right up to the lower lid margin and just pulling down on her cheek, and I'm lining up the tip just right under the lid margin. And I always warn patients that, when we're treating close around the eye, there is a chance of getting some bruising as these pins are 3 millimeters in length. Here we go. And when I'm doing these horizontal pulses, it's important that you don't overlap end to end. So I'm separating the tip from the prior pulse, again, so we don't get any rail marks. Now I'm going to come out a little bit wider on the eye. And because she's had the local infiltration and the topical numbing in this area, we're not using the Zimmer cooler in this region. If she didn't have the local infiltration, then I would be using the Zimmer. All right, so we just completed a total of about 170 pulses between both eyes on Carol, and now we're going to start in the cheek area. It's very important, I feel, to write down your settings every time you change them. So I always like to know on my patients how many pulses I did at any given setting. So that way when I'm seeing them back, it gives me an idea of what type of result I'm seeing based on the energy used and whether there are certain areas where I can go stronger. When the pulses are delivered, they can be delivered in a single pulse mode, which means you need to push the foot pedal to deliver every pulse. Sometimes when you're first starting with the treatment, it's a little bit easier to do that. As you get more comfortable with the movement of the pin, Then you can put it into a multi-pulse mode where you keep your foot down and it will pulse, repeatedly. There are different gradations between single pulse and multi-pulse. Most important thing though is to remember, especially when you're first starting, is to always wait to deliver a pulse until you have very good contact of the pins with the skin with firm pressure. Otherwise you can, kind of jolt the patient, spark the patient, and again, it's very unsettling for the patient when that happens. So I'm just going to pull back on the skin here in front of the ear. I'm going to apply the tip with firm pressure, and I'm going to deliver 3 pulses. Okay, so we're going to apply firm pressure and deliver 3 pulses. So they get a little bit of pinpoint bleeding, which is actually what you want to see. And then again, I'm pulling up and away on the skin and then applying pressure and my 3 pulses. Around the jaw area, I like to pull up on the skin quite a bit so that we get that nice, tightening underneath the chin, which everybody wants. So there's a little screw on the side of the tip, which you always want to point that screw in the direction you're moving. That way you know you have your rail marks in the right direction, and you just continue to do your 50% overlap. And then we look where the last row was and we go right next to it. So the more pressure you apply, the more comfortable it is for the patient. And we're trying to do some nice straight rows going from the jawline up to the upper cheek. Carol, are you doing fine? Do you think I can go up? So if the patient tells me that they're tolerating it fine and her skin is getting a nice reaction, I'm going to go up a little bit higher on her setting. So we're currently at a 25 fluence. I'm going to take that up to a 35. Carol's gotten a very nice even treatment here across the whole area of her cheek. It's diffuse in terms of the redness and the ablation without skip areas and without excessive overlap. So now we're going to come up a little bit here and go across the upper lip. So again, I'm going to stretch the skin, apply pressure, and release the pulse. And again. And in the medial cheek. You all right? Do you want me to lower it? Yeah, I'm going to stretch this way. Now we're going to come across her lower lip and chin. So for this area, I turn the tip perpendicular, so I'm marching across in that type of a direction with the rails perpendicular to her lip margin. And I'm actually going to come with the pins just right up to the vermilion border, so we can get rid of those little smoker's lines, water bottle lines, puckering lines. You have a lot of options on which tip to use, whether you want to do your ablation completely under the skin, like with this 24 coated pin tip, or whether you want to get more superficial ablation with a 60 pin, or get full thickness ablation with the 24 non-coated. Here we go. So you can see she had a little bit of that muscle contraction, so I'm holding even more tightly. And when you're using the Zimmer cooler, you want to blow in front of each pulse, so you chill the skin right before you get to the treatment. So far we've done a total of 690 pulses, so we're right on track for 1,000 or a little bit more for the full face. Just going to do a couple little pulses here. I see a little skip area on her chin. And I'm going to come across her upper lip. I try to pull the skin down to elongate the area under the nose. And this is a little bit more sensitive for patients, so I try to do it before the numbing has a chance to wear off. Sometimes I will do a perioral nerve block in this area, especially if we're going to try and do more aggressive settings. So a lot of women are bothered by these lines around the mouth, sometimes from sucking on a lot of straws, sipping from water bottles. So we're going to decrease the fluence a little bit on her forehead. The skin is thinner, there's not a lot of subcutaneous tissue there. I'm just going to turn down my settings. We were at 35 for the lower 2/3 of her face, and I'm going to take it back down to about 20 for her forehead, just like we did around the eyes. Because again, I like to do the triple pulse stacking on the forehead. Some doctors prefer to do double pulse stacking. All right, so we're going to start back over here, kind of just above the lateral crow's feet. So we're staying just above the cosmetic tattoo in her brow. I'm stretching the skin. Sometimes if you're in an area where you can't make good contact with the stretching, I'll actually do the opposite and squeeze the skin together a little bit to make sure I'm getting full contact with the tip. I'm kind of stretching and pulling up. So up on the forehead, you don't have to apply quite as much pressure. Still want to do good 50% overlap. I do like to pull up the skin a little bit, just so the skin doesn't move underneath the pin, but you don't have to do as tight a stretching in most patients. The skin's already pretty tight up there. And again, you can see we're getting a pretty nice even treatment across, and you want to avoid the hair areas. Now we're going to go ahead and do a couple of pulses on her nose. So when you're treating the nose, I always like to ask patients if they've ever had any kind of nasal surgery or nasal fracture prior to treating the nose, because we do squeeze and pinch the nose quite a bit. Going to have her breathing out of her mouth. And what we do with the nose treatment is a little bit different. We actually pinch and lift. And I'm going to deliver the pulses. Is that okay? And then for the top of the nose, we actually kind of lift the nose into the pins and apply the mild pressure and then release the pulses. And that can help for patients that are bothered by dilated pores, irregular surface texture. I'm going to put one in this direction. Good. And we're going to come to this side. And I'm going to place the pins and pinch up. I'm going to start treating Carol's neck now. The treatment procedure on the neck is a little bit different than it is on the face. With the neck, we tend to lift the skin up off of the muscle and then push the skin into the pins and deliver the pulses, as opposed to pushing down into the skin, which gives a lot of muscle jolting and is very uncomfortable for the patient. Okay, so I'm going to lift up the skin and push the pins into it and deliver the pulse. So again, I'm doing that 50% overlap and just grabbing the skin and trying to stay in a nice straight row. So again, we're just lifting, pressing, and pulsing. A lot of patients find the neck a little bit easier to tolerate because we're lifting the skin off the muscle. So I try to aim for somewhere between 500 and 1,000 pulses on the neck, if the patient can tolerate it, and if they have a pretty long neck, larger area. So in this area where the skin is a little bit more fixed to the jaw, sometimes having them lower their chin, go ahead and lower your chin, helps you grab that skin instead of having the neck extended. So now we're going to start doing second pass. So she was up to about 330 pulses on the first pass. And she has actually pretty good skin thickness in this area. So I really like to get some good tightening in this front of the neck area. So I often will do multiple passes. So I'm really putting some pretty good pressure on the back of the tip with my other hand so that the skin is secure in that area and off the muscle. Okay, let's see if we can get to this side. So Carol just completed her treatment, and you can see she's a little bit red, a little bit swollen, but we calmed her down quite a bit using a thermal spring water mask for 10 minutes. She's going to go home and we're going to put some bland ointment on her. She'll use the thermal spring water throughout the day, probably just for the next day or so when she feels a little hot or stingy. She'll keep the skin really well moisturized with the bland ointment. No sunscreen for the first 24 to 48 hours until all those little ablated areas seal over, and she's going to stay indoors and just have a relaxing couple of days. And then she's going to see that each day, you know, the redness and swelling will be gone typically within a day or two, and she'll have some little fine scabby crust for maybe 3 or 4 days. If she starts to get itchy, we have them use a vinegar soak with some white vinegar with cold water, and they can do some compresses on the skin to gently, you know, kind of remove the crust, but not to do any rubbing or anything harsh on the skin. And I prefer she holds off on any makeup for about 2 days. So after Fractora treatments, we give them an aftercare instruction sheet. Some of the things I definitely want patients to avoid are sun exposure. If they get waxing done, I want them to wait for at least 4 weeks to have waxing done, especially when we do treatments around the brow so that they're not tearing that young skin that's healing in. If they're having any discomfort, they can take some Tylenol, but really the procedure itself is a little bit uncomfortable while we're doing it, but afterwards patients typically feel fine and they don't need any pain medication. If they do, I prefer Tylenol over Advil or other anti-inflammatories because part of the healing process is the inflammation to induce new collagen production. What I like about Fractura is the ability to give patients really great results without a lot of downtime. And then also what I really like about the InMode platform in general is having a small office. It's really great to be able to offer patients up to 6 treatments on one platform and not have to purchase